Okay, we are currently recording. So welcome everybody. This is the Q2 action team meeting for MKE Elevate. So this is for economic security. My name is Rachel Lecker. I'm a public health strategist with the Milwaukee Health Department. And I do want to introduce one of my colleagues, Amanda. So I am currently 31 weeks, who's counting, pregnant. And so I will be on maternity leave from about July to October. And so Amanda's going to help us facilitate the next round of action team meetings. And she's also going to play a really strong role in the evaluation of the plan. So Amanda, if you just want to say hi and introduce yourself, you can go ahead.
Thanks, Rachel, and hi, everyone. I am Amanda. So I'm a fellow through the Wisconsin Population Health Service Fellowship. And I've been at the health department on the health strategy team since last July. And so I'm really excited to continue working with Elevate and to take over for Rachel in August.
Thanks, Amanda. So first of all, welcome. Thank you for joining. This session is recorded, so we'll be able to share it on our website and with the folks who weren't able to join today. Just some logistics about Zoom. So the chat is open. Please feel free to ask questions. I am able to see the chat, but I'll have some breaks in between the different sections that we talk about so that we can make sure that we're addressing any questions that we have. I've also put in the chat kind of a check-in Google document. So if you open that up, it does have a few questions where we're just kind of checking in with folks. So as we're talking, if you have questions about what I'm saying, if there's other ideas that you have, if there's needs that you have from the department, those are all things that we want to collect all the information so that moving forward, we can make sure we're really addressing what everybody needs from Elevate. As you've entered, you were put on mute. So just try to stay on mute unless you're speaking. And you can also raise your hand or come off mute if you have a question. If you come off mute, I think you pop to the top of my chat. So I'll be able to see that. And then the session also is recorded. I'm sorry, I have notes on my phone, so I just want to make sure that I have hit everything. Okay. And then also too, if you do have questions that we're not able to address during the meeting, maybe it's something that's more specific to your organization, or it's something that we can chat offline about, or it's a new idea that we might not have an answer for. I do have everybody's email from registering, and so I'm going to make sure to loop back if there is anything like that. Okay, so I have a couple of icebreakers. So only one question is really fun. The rest are kind of work related and meeting related. But I do have the long awaited answers from the registration poll about custard. And so that will come after this. So I'm going to go ahead and launch a poll. There's 4 questions, and so I can read through them. I'll give everybody a few minutes to fill them out, and then we'll just review the answers briefly. This is more so that myself and the team at the health department can really understand why people are coming to the table, maybe what gaps we have, and how we can really address some of the needs of the community in implementing the plan. Okay. So I've launched the icebreaker poll. So really today we're looking to see, what are you hoping to gain from coming today? So you can be, are you new to MKE Elevate and you just want to learn more? Do you want to hear about progress of the plan? Were you previously engaged and you want to learn how you can participate more? Do you want to hear how the health department can help you or your organization implement strategies around the priority action areas? And as a reminder, those are economic security, inclusive and fair society, eliminate racism, and positive mental health. And honestly, were you just told to attend this, so you're not really sure? Then the next question is, what area of economic security do you or your organization have projects, programs, or processes around? So this is really just saying what are you working on maybe in your organization So we can see what kind of the spread is of the folks who came to the table today, but also where do we have gaps, and where can we maybe create more partnerships or maybe create more opportunity for engagement. So fair housing access policies, healthy food access, job training, skill enhancement, educational opportunities, affordable childcare or high quality early childhood education, a living wage, financial literacy, or youth engagement and development. And these are all objectives within the economic security part of MKE Elevate. So if you are interested in getting to work more on any of these subjects too, please note that down because we'll be able to engage you maybe with some of the other organizations. Then what types of training and technical support would you initially be interested in from the health department around your work on economic security or any of the other action areas? Would that be like a panel or a town hall series, maybe with local, regional, national experts that work specifically in these areas? Would you want to have a one-to-one sit down with staff just to kind of hear about what you're doing, what your needs are, what we can help you with? We could do webinars about local resources, policies, and projects. Would you like some funding or how to collaborate with organizations who have funding for projects? Assistance making connections to other groups in the community who might be doing similar or the same work? Data sharing, or a monthly newsletter with webinars, meetings, work groups, resources, policy updates, committees, important votes, etc. And then last but not least, what are you most excited for as the weather is getting nicer? Going for walks, hikes, bike rides, swimming, or just sitting by the pool or the lake, boating, camping, or glamping, bonfires, beer gardens, outdoor eating and dining, summer vacation, traveling, staycation, anything just not working, or gardening. So we have about 70% of folks have completed the question. So we'll just wait a couple more minutes. All right, we are gonna wrap it up. So I'm gonna end the poll. And go ahead and share the results. Okay, so what are you hoping to gain from the meeting today? So the majority of people want to hear how the health department can help their organization implement strategies around the priority action areas, and also to hear about the progress of the plan. What area of economic security do you or your organization have projects, programs, or processes around? So we do have a lot of folks that work around healthy food access, which is awesome. And then it looks like we have youth engagement and development, fair housing, and then a handful about job training, affordable childcare, and a living wage. The majority, about 4 people, said panel or town hall series, but it looks like folks want their information in a spread of different ways. So this will be a good way that we can connect with each individual group or organization, to just kind of talk about what the needs are. So this is really helpful. And then what are we most excited for? Not working. So thank you guys so much for filling that out. That'll be really helpful for us internally, just to see what folks need, what kind of is bringing people to the table, and how we can start to address gaps. And then from our registration, I asked, what is the best custard in Milwaukee? So this was the breakdown. Cops did get the majority of votes. And then second was Leon's, and then Gillies, other Culver's and kits. And someone did make a comment that Cops has the best custard, Culver's has more options, or like more, you can like customize better. And so I just really liked how someone was analyzing the different custard options in the city. So I just thought that was fun. Now it's custard season, and we can start to enjoy some of those treats during this nicer weather. So I'm going to briefly go over MKE Elevate. I do see a lot of familiar names and faces, but I know that some folks are new to Elevate. So I just want to go through a quick review about the plan and just go over the goals within economic security briefly. So this is our MKE Elevate wheel. I know the text is pretty small, but I just wanted to show that our overarching vision is to support safe and healthy neighborhoods by addressing the physical and social environmental factors that significantly influence safety and health in 3 priority areas. And those are economic security in green, positive mental health in blue, and inclusive and fair society in orange, which in 2020 we have added eliminate racism at the end of that. And in some of the text that I've started using around Elevate, sometimes I'll just say equity when I'm referring to inclusive and fair society, eliminate racism, just to save a minute of talking. But when we refer to equity, that is the priority action area we're talking about. And so today's meeting is for economic security, and the goals of economic security laid out within the plan are improve access to basic human needs, such as safe and affordable housing and healthy and affordable food, improve access to and quality of education, and improve access to employment that provides family supporting wages and benefits. And then here is for eliminate racism, strengthen and enhance neighborhood and civic leadership, enhance community connectedness, and promote equitable laws and practices. And then positive mental health, improve access to mental health services, improve mental health perception and reduce stigma, and become a trauma-informed city. So those are the overarching goals for each of the priority action areas. And I'm sorry, I have really bad allergies, and this is like 10 times better than it was last week. And so I apologize. I'm gonna keep coughing and my voice will go in and out and I'll be sniffling, but I'm excited to be here. So I just apologize for hacking all over the screen, especially because it's recorded. So this is the layout of the plan. This is actually the first goal in economic security. And so we have objectives that are, so the goals are overarching. And so the 3 goals are trying to really be overarching to the areas and the sectors of economic security. Then the objectives become a little bit more detailed. And then the strategies are very detailed based on the work of the implementation partners at the time the plan was created. And so I know from the last round of meetings, the way the plan was laid out was a little confusing to folks because the implementation partners looked like they were the only ones working on what was going on within the plan. And so I'm hoping today to clear that up just a little bit. Um, the way the plan was created was so that over time we could actually add on to the plan. So these strategies weren't set in stone. These were just connected to the work that was being done at the time. And so while we want to have some strategies that we can track over time, it was meant so that we could add strategies and implementation partners. Unfortunately, there was some staff turnover at the health department as well as COVID-19. So we weren't able to update the plan throughout the process, which this current chip cycle is 2017 to 2021 or 2022, sorry. And so that is why it looks, the way it's set up right now is it's very stagnant, and it was supposed to be more dynamic. So when you're a new partner, or maybe you're not a partner that's listed as an implementation partner, but you're an engaged organization, focus more on the goals and some of the objectives when you're looking at how can I participate in the plan and how can we get involved. Because within the goals and the overarching priority action area, you'll be able to see how your organization can really fit in. Whereas some of the strategies are more specific. And if you still have questions about that too, feel free to post those in the chat or in the check-in document as well. And then just very quickly, the health department within the CHIP, so Community Health Improvement Plan, shortens to CHIP, and we call our CHIP MKE Elevate. So the health department really is a facilitator to the work that's already being done by community organizations. So we're listed as a partner in the plan a few times, but it's not the health department outlining what we're going to do. It's how are we going to facilitate the work that's being done with community organizations and community members. Okay, so I'm going to pause. I see there's some things in the chat. Oh, some allergy support. Thank you guys. Oh, and thank you on the congratulations. Yes, I am ready to be done being pregnant. It just scrambles your brain, and I know it's not going to be better for the first few months while he's here, but oh, very excited in this house. We'll have 2 little boys soon. All right, so we are going to review the Q1 action team meetings. So the last time we met was February 2021. As I mentioned before, a lot of folks had questions. Maybe if people were new, they didn't really see where they could fit into the plan. It was kind of confusing what we were evaluating. When you look at the plan, it's not a very quantitative plan. So there aren't metrics that we're trying to meet. It's more a vision of the way things could be. So that can be really confusing. When we talk about evaluation, I know in my head, just from like being in school, you always think that you want to quantifiably measure things, and it's kind of hard to wrap your head around how can we qualitatively measure and how can we do a different type of evaluation. So I'm going to address that. Um, and then when we are looking at how do we evaluate success with the plan, how can we do that when there was a gap in implementation and we lost some of our partnerships and we've had to rebuild over the last year? So I want to clear up confusion. I want to see if anyone has questions, try to help clear up questions or just gather everybody's questions so that I can make sure that from our team that we're really acknowledging what some of the confusion is within the community, and then also hear ideas about how the health department can help your organization through this process. Oops. Okay. So what we've learned at the health department, just from re-engagement until now, from the last set of action team meetings. So I know the way that I tried to frame it in the first action team meetings in February was let's just pick up where we left off. We'll try to engage the partners. We'll try to see what people have been working on. We'll have a similar structure to the way the action teams were previously. So we know that we can't just do that. There's a big change in the world and it's COVID-19. So the way that MKE Elevate is structured, the different partnerships that we have, the way we have partnerships, just the way we're meeting today is incredibly different than how we envisioned when the plan was created. And then even the strategies, when you read through some of the strategies within the plan, we know that COVID has exacerbated the disparities and a lot of the public health issues that are within the plan. And so if we just pick up where we've left off, we're not really acknowledging that these public health issues were a problem in 2017. And now we've had a pandemic that has made life and economic security, equity, and positive mental health a lot worse for a lot of our community members. So when we're thinking about COVID and really acknowledging how that's affected our work, one thing that we're able to do and kind of what we've learned is that the sustainability of economic security, eliminating racism and equity, and positive mental health, these three things really still are important. It might not be the specific strategies within the plan, but these overarching priority action areas are going to be really key in the COVID-19 recovery process. And so, where we are in the plan is implementation. And so, we're kind of looking in the past to see what have we accomplished to date, but also looking forward into how can we start to incorporate all of the priority action areas and the work that we're doing moving forward. So we're kind of in a unique time within the plan, but I'm hoping that when you come to the table, you can either see that you've fit into what we have been looking at in the last few years, but also when we're looking ahead to recovery as well. So I hope that makes a little bit of sense. We've also learned that we have a lot of new partners coming to the table who have new ideas, and they might be engaged in different work than what we've previously had folks engaged in. And that's awesome. What we want to do is make the plan more dynamic than it was. That wasn't our intention to have kind of a static plan that didn't really change. But as I mentioned before, because of COVID and some staff turnover, we weren't able to update it as we wanted. So we want to take new partners and new ideas and really keep developing the plan over time and making sure that when something like COVID happens, hopefully never again, but because it happened during this cycle, that we're able to acknowledge it and really create or continue a dynamic plan. And then also improve longevity. So the health department has committed to sustained implementation of this plan. So one, my role was created. So I'm a public health strategist, and my role focuses on implementing the chip. So just the creation of a specific role that focuses on the chip has been part of the health department's commitment to making sure that this doesn't drop. We've also committed to building out our health strategy team. So that's the division that my role belongs to. And so we're going to build out some more of the public health strategist roles. And so we'll have a bigger team that can help to engage with this work and also engage with partners out in the community. We also are creating distributed leadership. So Amanda, who is going to take over for me during maternity leave, we're really thinking ahead and thinking how can we really engage other members of MHD so that even if someone has to go have a baby or there's a pandemic or even if there's any sort of other emergency response where some focus and resources have to be pulled, like from myself or any of the other team members, that we have more distributed leadership and there is no chance or less of a chance that we would drop the ball in implementation like that again. So these are just some internal learnings that we've had. And so we're really trying to apply those to the continuation of the plan. So just if you have questions about this or ideas, you can drop those in the chat or the document. The other piece from last round is that I took all the notes that each of the action teams had, and the three areas where people really wanted to see action and had the most questions around were data, increased and improved partnerships, and then support from city leadership. And so, as I mentioned before, concerning data, the goals, objectives, and strategies within MKE Elevate aren't really easily quantifiable in most cases. It's more built as a vision of what the city could look like, or um, they're more qualitative in that you can't really say, okay, yes, now we've created economic security, or yes, now we have a system tried and true about how to train folks to have job security. So when we're looking at data, we kind of have to shift our focus into more qualitative process improvement and then track partnerships and the strength of partnerships, how we've built partnerships over time, how we're using partnerships. Um, and then in terms of data as well, I know some folks had said they're looking for ways that they can get more engaged in the plan. So this year we are doing our community health assessment. And so that's part of our continuous quality improvement cycle. And all health departments who are becoming accredited within the country follow this cycle. So the community health assessment is a data assessment. And if you have an idea about what the health department should look at when identifying public health issues in the city in terms of quantifiable or qualitative data, if you want to put those in that check-in document, that can be a way, and you can put your name next to it or your organization if this is something that your organization focuses on. But we'll actually take information from the community health assessment and then implement that into the next round of MKE Elevate or a community health improvement plan. So this was just an opportunity that I know we have a lot of engaged folks on the call today. So I just wanted to let you know there is that opportunity to get involved with data. Another piece that we wanted to see action on was increased and improved partnerships. And so this was in my head again a way to quantify like when we are engaging this many people, we can show that we've gotten the word out there. And so, well, we want to grow membership, we want to keep building the action teams. I also want to strengthen the partnerships we currently have. So, my commitment is to meeting one on one with each organization that's engaged as an implementation partner, a steering committee member, or an action team member. And I really want to just kind of have like an informal conversation. And so, again, this will be something that I'll take on until the summer when I go on leave, and then Amanda will take over. And then we're also building out our team this summer. So we'll have some more strategists that can engage in this work. But we want to hear really like what matters to you and your organization in terms of evaluation. So, is there something that we can align to maybe the strategic plan at your organization? Or maybe there's some evaluation metrics that you might be having a hard time kind of just getting information about. Can we align and how can we partner and what really matters to you? We also want to hear about your successes. So, what are some of the things that you're doing at your organization that maybe you've had to pivot because of COVID and you found that this new way of engaging the community has worked really well? Or maybe there's something around job security where, you know, a lot of other organizations have been kind of trying to figure this out, but the way that you've brought together this group has been really successful. We really want to hear what are you doing that's been successful, and do you want to share that with others or share that with us, and how can we implement that in our work? We also want to hear what are some of the lessons that you've learned, maybe through your committees, your partnerships. What have you learned in terms of implementing some of these strategies and objectives within the plan? Because that can help us when we kind of create assistance for the other groups that we're working with. Also, how has COVID impacted the work that you've been doing? I think that in and of itself is a way to build our partnership, is just to see like, is there some place where you really took a hit? I know for us, definitely engagement has been really difficult to get folks to the table. I know we're all experiencing meeting fatigue and we have back-to-back meetings, and it's really difficult to just be talking to a screen. I know it doesn't sound like it because I love to talk, but it's hard not to see faces and really meet people and really hear what's going on with them. So what is a way that COVID has impacted your work? And then we want to hear what can we do differently at the excuse me. What can we do differently at the health department? Is there something where you were kind of waiting for us to reach out to your organization, or there's just a better way that we can partner. So these are all things that we really just want to sit down with everybody who has taken the time to come to the table and just learn more about you, hear about your successes, and hear about how can we do better? How can we have a better partnership in this process? And then support from city leadership was another area where a lot of folks wanted to see some action. Sorry. So one way that we've had increased support from the health department leadership specifically is the investment in the health strategy team. So we will be building out our team with more health strategists. Also, to put in a quick plug, we are hiring a director of health strategy. I think that posting expires sometime this week. I think it might be tomorrow. But if you or anyone you know are interested and you want to build out the health strategy team, we are hiring. We also have full support from the health department leadership around COVID recovery. As I mentioned, the work around economic security, equity, and positive mental health actually transcends the COVID-19 pandemic. And these are areas where a lot of our community members are doing not doing as well or doing poorer now than they were even when these were identified as priority action areas. So amidst COVID recovery, we definitely are channeling funding and resources and attention to the priority action areas in the context of COVID. And then also workforce development around priority action areas. So identifying where staff can attend trainings, implement trainings, and really bring groups together to create more capacity within the health department around these areas. And then also at the city level, recently the City of Milwaukee Office of Equity and Inclusion has been established. And I am actually one of the representatives for the health department on the racial equity leadership team. And right now, everybody on the leadership team is going through racial equity training. And so, even though equity is one piece of Elevate, it really transcends the work that we're doing through all of the priority action areas. So, that is another way that we've gotten support from city leadership. And as we go through the plan and we're kind of going into the next cycle and thinking about what do we want to see in this next cycle, city leadership will definitely be engaged and involved in that process as well. Okay, so I'm going to pause here. And I just want to see if anybody has any questions at this time. So you can raise your hand, you can go off mute. I'm actually going to stop sharing my screen for a moment just so I can see if anybody has any questions.
So I have one question. Hi, everyone. Congratulations, Rachel.
Thank you.
So, in looking at the evaluation, will it be one in which a plan will be proposed? Since you stated earlier that no metrics will be set, is it just an evaluation proposal of ideas of how the work should be, the outcomes of the work should be evaluated?
Yeah, so in this next section, I'll go over. So we met probably 2 weeks ago with kind of an internal MHD team, and we engaged the consulting group, Ujima United, that was involved in leading the creation of the plan. And then we also engaged health strategy and then data and evaluation at the health department. So I'll go through the metrics that we're thinking of going over. And I know Amanda's going to play more of a leading role with that. I'm not going to put you on the spot, Amanda, to explain, because right now we're really just at the planning stages of like, what do we want to focus on based on where we are with COVID and implementation. But I do ask, like, what are we missing? So if there is something where like, I really think we could focus on this, or the way I'm envisioning it is we could add this measure or something like that. There will be space to get some feedback on it.
Gotcha. Thank you.
Mm-hmm.
Would I be able to go next?
Yeah, go ahead.
Yeah, I'm Yvonne Greer. I'm part of MKE, which is the Milwaukee County Organizations Promoting Prevention. We have been in existence probably now for upwards of 14 years, and we have a mailing list of probably 150 people and have in different organizations and have over 30 to 40 agencies that come to our quarterly meetings. We've recently gotten a grant that is part of what they call catalyzing communities, which is like cities from all over the country. There's about 6 different cities that's part of it. Milwaukee, we're leading the Milwaukee effort, and we've been doing from end of August until February, we were doing community-based systems dynamics work, looking at the whole system, looking at causal diagrams, doing this with almost 14 different agencies at the table. And we're going to be doing workshops in the community. I want to bring that to you because when you talk about engaging partners, engaging communities, we're doing some of that work already. And so I just want to know, as we start looking at what you're doing, how are you looking at connecting to groups that's already doing some of the same type of work, so we're not reduplicating? And that's why I wanted to make sure I came, so we could have true transparency that some of the things you're doing sounds much similar to what we're doing, but as far as doing the visualization of the system, we already have causal loose diagrams, and we're going to be sharing that information broadly. So sharing it with you and anyone who wants to see it. But it's almost like we're working side by side, and I want us to make sure we're connecting.
Yes, absolutely. So that's really the vision, I think, of Elevate, is that the health department isn't the one doing the work, but we're bringing together the groups that are, so that I know in some spaces, people are doing the same things. I know a lot of organizations have strategic plans that focus on all of the same things. And so we're really, again, just doing the same work, and we don't want to be siloed. So this would be a perfect opportunity to take some of the information and the data and all the findings that you're getting through your collaboration with other groups and share it to this group, so that we're just kind of the connector in this space. But this is exactly the type of partnerships and the information sharing that I'm hoping to get more of through the action teams. So I really appreciate you saying that, because that's exactly the walls that we're trying to build down. And unfortunately, through the lapse in engagement, we weren't able. So the way that I kind of frame it in my head, and kind of when I explain it to new partners, is that the work didn't stop because we weren't engaging the community, but what we lost were the strength of our partnerships and the ability to facilitate and bring people together and create more opportunity for folks to collaborate. So while the work has continued, what we're trying to rebuild is that connection between the organizations. And then another point that you brought up that I just want to quickly bring up too. So right now we're within the implementation and evaluation space. So the years of this cycle are 2017 to 2022. And so while we're implementing and evaluating the plan to date, I'm also starting to think about how can we plan for the future, for the next cycle. And then one of the things you said was just your collaboration with other cities and groups. And so that's another thing that I think as the year goes on, we'll start to get deeper into discussion about how can we ensure the work of Elevate is sustainable, because the way that it was initially created, we've seen that through COVID, we weren't able to keep that structure, and it wasn't able to withstand. I know a lot of things have not been able to withstand COVID, but just better preparing. How can we see what other groups are doing, and again, more of that collaboration so that we can really sustain the work that's being done.
And I definitely will be sharing with you, and you can share with the group, that there is a website for the catalyzing communities. We have our own page on there. Other communities have their page, and Tulsa and Somerville and all these different places have their own pages. And so that collaboration with that group is already gotten a grant for another 2 years. Definitely, I think MKE Elevate might see some potential opportunity in, that collaboration as well.
Mm-hmm. Awesome. Thank you so much. Yep, that's exactly what I'm hoping to rebuild and create stronger from now into through the rest of the cycle, and then continued into the next cycle, is really just, we're not creating anything new, but we want to bring together people so that we're, again, not duplicating and doing double the work. So thank you so much. Does anybody else have questions about that piece? All right. Oh, Daphne?
No, I'm sorry. For some reason, I'm having some technical difficulties. So you guys are in and out, fading in and out. I have to keep hitting the mute button. It's really weird.
Oh, I'm sorry.
My apologies.
Okay, no problem. All right, so I am going to, I see I have been a little chatterbox, so I am going to quickly go through evaluation. Oops, sorry, let me share my screen again. And then we can get to some success stories and then give everybody else a chance to talk. Okay. So for evaluation, these are the indicators that, again, that internal group from MHD has discussed. How can we take where we're at in the process and really define some indicators that we can measure? So one of those is through partnerships and collaborations. So through the beginning of the plan, there were partnerships created. There were different folks engaged at that time, and we've been able to sustain some of those partnerships. We've re-engaged some of them, we've lost some of them, but we've also created new partnerships. So that is one way that we can look at, it's one way is a quantifiable, how many folks or how many organizations have we created partnerships with, but another way that we can look at this is the strength of the partnerships, or in the organizations identifying how they want to be partners. So do you want to just attend action team meetings? Do you want to be very involved? Like, do you want to be one of the organizations that helps create the next round of the plan? Are you collecting indicators on our behalf? Are you creating collaboration? So that's one way that we can start to evaluate the strength of Elevate, is through the partnerships that we've created. Another is a process evaluation. So as I have talked a bit about during this presentation, this presentation, is that the process of MKE Elevate, the way it was created and then the way it was actually implemented, or how there was a lapse in implementation, we can really evaluate that process and evaluate what can we do differently, how can we make sure that in the future this is sustainable, even if there is change in staff go on leave, if there is a pandemic, things like that. And then directly related to that is internal health department learning. So what have we learned as a health department when it comes to engaging community organizations, even just how we engage people virtually? Are there ways that it works better to engage folks, or just just different ways that as a health department, we've learned through this process. This is something that worked, something that didn't work, something that we want to improve. And then of course, quantitative measures. So while most of the plan is more visionary, there are areas where we would be able to pull data and compare data over time based on different based on different published documents and data sets that are available. And there are some indicators that were identified in 2017 when the plan was created that we could go back and see if there was some positive change over time. One note about quantitative measures within the plan is that we know that COVID probably made most of the measures worse. So while in 2017, we wanted to see an increase in maybe early childhood education centers that offer high quality early childhood education, COVID shut down a lot of early childhood centers, and a lot of kids were sent home. A lot of kids weren't in formal schooling for the last year. So that could definitely, there's always going to be a caveat, I think, amidst COVID. So that's just one note. And then for evaluation, what are we missing? What are some other things that we can look at in terms of how we evaluate the success of the work that we've been doing? And so if you do have other evaluation ideas, you can put those in the check-in document or the chat as well. Okay, so now I'm going to turn it over to some of our guest speakers. I'm going to stop sharing. And first we have Amanda. So Amanda, again, is working with us at the health department, and she's going to share about a success that the health department has had in collaboration with other groups around the Fresh Food Access Fund. So Amanda, you can take it away.
Thanks. Yeah, I'll try and keep this pretty brief, but I also want to acknowledge that many of the people on this call have probably been involved in some ways in the Fresh Food Access Fund, in the initial advocacy, in the evaluation. Maybe some of your organizations have received funding through the Fresh Food Access Fund, or you've participated in other ways. But I just want to share that I think this is an interesting model for collaboration and investment at the city level in funding some of these community-based projects or to increase access to fresh food access. And so with that, I'll share like a brief overview of what the Fresh Food Access Fund is, maybe for those who haven't heard of it before. So this is through the Department of City Development. They provide financial support to activities that increase access to healthy foods, particularly in neighborhoods that are underserved or have limited access to healthy foods. And so these are activities aligned with the strategies that were identified in the Department of City Development's Fresh Food Access Report. So these are things like attracting grocery stores and mobile market stops to underserved neighborhoods, developing other retail outlets for fresh foods, or increasing nutrition education. There are 7 different goals that this fund is aiming to support. And so the first round, which was implemented last year, allocated $400,000 to 22 different projects that were broken into 2 kind of groups. So there's some projects that were capital projects, and so these were to support the renovation of space, the development of new retail outlets, the expansion of community gardening programs, anything that were larger expenses. And then another bucket was the educational projects. And so these were projects to increase nutrition education, to increase the demand for healthy foods. And many of these projects also, in addition to supporting nutrition education, supported the distribution of food as well, or the development of different programs for gleaning or environmental accesses to reduce food waste as well. And so with this amount, the projects were able to be really creative in different ways, which is exciting. And so this also provided an opportunity for city departments to collaborate in different ways around increasing fresh food access. So This has been a collaboration both with the Department of City Development, but also the Health Department and the Environmental Collaboration Office and the Department of Public Works. So we've been able to, at the city government level, participate around fresh food access in ways that we maybe haven't in the past, in addition to collaborating with community partners. Particularly Danielle and Obi have provided invaluable support on evaluation, technical assistance, the overall visioning of this program, and the identification of strategy that we're hoping to be able to expand and continue in the future. So this project specifically addressed a couple of the different goals from Milwaukee Elevate. So those goals are around improving health education to increase demand for fresh and healthy food. This also is part of establishing a food trust model that creates a flexible city fund to address food access. And it's also supporting the development of other retail outlets as sources of fresh foods. So I think there's a lot of incredible potential in this model as we continue to implement this and support funding for different projects in the future.
Awesome. Does anybody have questions for Amanda about the Fresh Food Access Fund or just this model of implementing mini grants in order to fund? Oh,
Yes.
Danielle does have a question.
Danielle in the chat. The city is considering adding ARPA funds to expand the Fresh Food Access Fund. I think it'll be about determining the process of the priorities. This has come up in a number of the public meetings that have already been held about the ARPA funds. And at the Health Department, we are also thinking about ways to use some of the grant funds that might be coming to us to support the expansion of the Fresh Food Access Fund. So I think this is something that we are very hopeful will happen.
Anybody else have questions for Amanda? Okay, great. Thank you so much for sharing. So next, oh, Yvonne had a question. Will there be a report out?
Yes, I wanted to share, I could talk, so this was a very quick brief version and I see I was talking really fast because I have a lot that I would love to share about this. And so we do have plans, hopefully in collaboration with Danielle and Obi as well, who've worked on the evaluation for last year, to share more in a longer format about how this has worked, and we can talk more in depth. We could probably spend hours talking about this in the future, but we'll plan on doing that.
Awesome. All right, so next we have Meg. And Meg, did you want to share your screen or do you want me to share the PowerPoint?
Yeah, I can share. So I see that that's an option. So I will do that right now. Hopefully you all can see my presentation okay. All right, so hi everyone. Again, my name is Meg Kilkenny. I work for UW Extension with the Food Wise program here in Milwaukee County, and I'm going to be chatting about the Milwaukee Farmers Market Coalition today. So the Farmers Market Coalition began in 2015 with a goal to increase access to and utilization of farmers markets by low-income shoppers, ultimately with the long-term goal of increasing produce intake in Milwaukee. The shorthand URL bit.ly/EBTMKE will take you to our webpage. This coalition is co-facilitated by myself from FoodWise, as well as Fondy Milwaukee, the organization who operates the Fondy Farmers Market and the Milwaukee Winter Farmers Market. I will also copy and paste our webpage link in the chat shortly. So the coalition meets bi-monthly to convene Milwaukee County area markets and other partners. Over the past year, we've spent a lot of time troubleshooting what COVID-19 safety shopping guidelines look like, but also discussing how to continue to build capacity for farmers markets to accept EBT, and more recently, building up a system for a coordinated nutrition incentive program. So often referred to as market match, these kinds of programs double the purchasing power of SNAP shoppers by matching their benefits with coupons to spend on fruits and vegetables at the market. So For example, if a shopper spends $20 on their Quest card at the market, they receive an additional $20 in incentives to spend for free for a total of $40 altogether. So there's lots of research out there indicating that point of sale purchasing incentives are a great way to increase healthy food access and encourage eating more produce. For 10 weeks in September through November of 2020, the coalition piloted the Milwaukee Market Match program. This was the first ever coordinated nutrition incentive program in Milwaukee. It took place at 5 participating markets across the county. Pictured here are the coupons alongside the regular EBT tokens at the River West Market. And our pilot was funded by the Greater Milwaukee Foundation last year. In that very short time frame of just 10 weeks, with only 5 markets participating, the pilot program served 786 unique households from 37 different zip codes, some in Milwaukee County, some outside of the county, for a total of $19,653 spent in nutrition incentives. So, we're imagining the kind of impact this program could have with even more resources and expanded to even more farmers markets. Quick shout out and thank you to the Triumph student Kahua, who I worked with for this data breakdown. I would be happy to send some of these details to folks if they are interested. All 5 participating markets had to create a unique customer ID for each Quest card transaction, as well as ask the shopper their residential zip code, which is the way we were able to track this data, and also allowed us to limit matching funds to $20 per person per market day. The coalition is currently in conversation with potential funders about expanding this program to include even more participating markets, and also hopefully to have it be implemented for the entire 2021 season and not just a couple of weeks. So our ability to track data for our work is largely based on the capacity of farmers markets. So really one of the only tangible ways that we assess whether or not we are truly increasing access is by looking at SNAP sales. So we are able to get this countywide data from the USDA. In 2019, SNAP sales in Milwaukee County at farmers markets totaled $73,000, while in 2020 they were $107,000. So that is a 32% increase, which is really exciting to see. And really just for context, for this work in general, less than 1% of SNAP dollars are spent at farmers markets. So this is not just a trend in Wisconsin, this is nationwide. So we acknowledge the opportunity that exists to continue to increase these numbers and bring more federal dollars into our communities. So we also work with Hunger Task Force to create a resource annually that lists all the markets in Milwaukee County that accept DBT, as well as WIC and Senior Farmers Market Nutrition Program, or FMNP vouchers. This gets distributed throughout the community. In general, the coalition also acknowledges that farmers markets historically and oftentimes still presently have predominantly been white upper middle class marketplaces, and that we have a responsibility to shift that culture to ensure that all are welcome, to ensure that all are comfortable and connecting with their local food producers and shopping at farmers markets. So increasing EBT acceptance and proudly welcoming it is a way that we can shift that culture. I know I'm probably up on my time. So my last slide here is just a picture of what our 2020 farmers market list looked like. Our 2021 one is in the works. So if you or your organization would like printed copies of our version for this year, you can email me and I can put you on our distribution list. So I'll put my email in the chat. Thanks, everyone.
Thank you so much, Meg. Does anybody have any questions for Meg?
Yeah, I do. This is Jamal from the Office of Violence Prevention. Quick question. What is your marketing strategy made to ensure that the low-income families that you all are targeting are actually abreast on these resources existing?
That's a great question. And we've been working to expand that for many years, in which we have found the best way for people to find out that they can use their benefits at markets is word of mouth. So we definitely do a lot of signage and stuff at the market. So when people are passing through, they know where to and how to use their benefits. But that brochure that I showed an example of is something that gets distributed through Hunger Task Force's entire pantry network, as well as when they are distributing senior nutrition program vouchers. And then we also work closely with several different community partners, other pantries, really, and also on site at farmers markets to let folks know that that's a possibility.
Have you all considered potentially partnering with, like, let's say NSP organizers that that the city has, because they're, all of them are located in various neighborhoods across the city, and many of them are in the neighborhoods where a lot of the residents that you all are targeting live. So I would imagine like NSP organizers, maybe Safe and Sound organizers who do a lot of community outreach. That may be another focus potentially in terms of getting those resources out. It's getting them in the hands of those organizations that do a lot of door to door, and then being able to, potentially pass those resources out in that manner as well.
Really quick, what is NSP?
Neighborhood strategic planning. Yeah. So that's that. The NSP is through the CDBG here at the city. So they've got, like, again, a number of organizers are set through that program, and they go to targeted neighborhoods. So there may be another resource to connect with.
Fantastic suggestion. Thank you so much, Jamal. I will also acknowledge that I think in pre-pandemic times, we were connecting with community health workers as well. So some of that door-to-door kind of has paused. So we're hoping to re-engage with spreading the word to those kinds of folks this season. So I've made a note of that. Thank you so much. And Danielle just posted in the chat too that there have been some social media ads. So Facebook and Instagram, targeted by geography and demographics. That's a program of extension. So we also do have kind of that digital outreach component as well.
Anybody else have questions for Meg? Elizabeth, did you have a question?
No, thank you. No.
Okay, sorry. All right.
Oh, there you go. Elizabeth is on here. There's a Safe and Sound organizer. Right?
I was going to say that, but I didn't want to put her on the spot.
I am, and I'm also an NSP.
And she's an SP.
There you go. Perfect. That's exactly what we're trying to do with these meetings, is just connect people, because I think Jamal brings up a good point. If there's already people and organizations going on the streets that you're trying to target, if you can just get the flyer in their hands or in their resource packets, or get them trained to talk about the work that's being done, that is absolutely the best thing, the best way to get the information out there. So I really, really appreciate
Rachel, even our 414 Life team, especially with them being posted in garden homes in the old North Milwaukee neighborhoods, and we understand the definite impact or the disparate impact of poverty in those neighborhoods. They could definitely use those resources. And then plus, we're expanding to the South Side. So that will be another resource in terms of community outreach as well. So you got to just tap into all of that to really get those messages across if possible.
And I think that's something too, that from the facilitation of the health department perspective, is that we can help. So like if there are different programs that we want to highlight through the partnerships of Elevate, if we can get some of the community organizers to come to a webinar, and we can just boom, 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 this is this resource, this is this resource, this is how you talk about it, this is a contact if you have a question about it. We can just build up the capacity of people who are already doing this work and give them the resources and how to communicate about maybe what the public health issue is, or what some of the programs, processes, policies, all of those things. So that's definitely something that I think is within the health department's capacity. If we just have an idea, how can we bring these groups together and just train them basically on how to talk about these issues and how to connect folks to those resources. And not to put Jamal on the spot, but OVP knows everybody. So if you ever have a question, they are very well connected to like everybody in the city. But thank you guys so much.
Nah, we ain't got it like that.
All right, so we are going to move along to Tim. Tim is from the American Heart Association. Hi, Tim. How's it going?
Going well, thanks. Good afternoon,
Okay.
everybody. And I think that last tee up from Megan, actually, some of the conversation that followed is kind of a perfect lead into what we just wanted to share a little bit about, and that is our work on nutrition insecurity screenings. We identified the process of screening for food insecurity out of our community listening sessions that we held last summer, early fall, with about 30 different community leaders from around the city and all different types of organizations. They identified first that food insecurity was a priority that AHA should be involved in, and certainly the Fresh Food Access Fund is one example of work we've already done in that regard. But then they also helped us realize the benefits that nutrition security screenings could provide to the community as a whole and to individual members therein. And as we talk about the work that, distributing the information about SNAP at farmers markets and the like, and how do we identify where that can be utilized, I think things like nutrition insecurity screening help organizations identify which constituencies they're serving that can benefit from that. So I shared a couple documents with Rachel. I don't know if you were going to try to pull those up or if we don't have time for that or not, but the basic concept of this is that in spaces where people are naturally gathering, be that at a medical clinic, a church, onboarding or enrollment at a YMCA or Boys and Girls Club, that organization would somehow be equipped to ask them those two questions that you see there using the hunger vital sign assessment. And just trying to get a little bit of an understanding of where people's needs are. That can be done in person. We were also talking to some organizations who might do it more systematically, that as students come back to school or something, that they could be asked that more electronically and just have that data gathered in the aggregate. But then as individuals do answer yes to one or both of those questions, the organization would help connect them with a set of resources to help meet that need. And it could be both kind of emergency immediate assistance, the food pantry down the street type thing, as well as information on how to sign up for food share, how to register for WIC, meeting both that short and long-term need. And I think part of the reason I wanted to share this and appreciated Rachel's invitation was this is an example of work that, on the one hand, the Heart Association doesn't have the ability to directly play a role in this. We don't have a ready population to screen. We don't provide the food services that can help meet that need. But if we can help pull together resources and interested individuals and organizations to coalesce around this concept, it can look different as it iterates throughout the city. But collectively working with organizations, some of on this call and others, I think we can better understand the true level of food insecurity in the city, while also pointing people directly to the resources that can help alleviate that. So just wanted to share that kind of as a process success, if you will, so far, as well as certainly to invite now or later on ideas you all have in terms of organizations that you think would want to kind of add this to their portfolio of services and resources that they're providing for their community.
Thank you so much. Does anybody have questions? Oh, go ahead, Yvonne.
I had one. Have you thought of, because when I looked at the first part of that, it seemed like that was a tool piece that the agency would use. Have you thought of making this more of a self-assessment tool and hooking the self-assessment with the two questions so that people can self-evaluate? Because sometimes it's very sensitive. And so, maybe even having that as a self-assessment tool so that, you know, if people see that they fit into that, then you still have that resource piece of it that they can have.
Yeah, I think it's a great idea, and something that has more or less come up in some of the conversations. You know, you mentioned a topic, so there's language on here around that, and trying to capture people in an environment that they have that level of trust. But even beyond that, the example I mentioned with one of the local universities we're talking to, that would be more of a email survey that went out to students as they come back to campus in the fall, allowing them, just like you're saying, to self-evaluate in the privacy of wherever they're at, and then based on their answers, get directed to resources that could help meet that need. So yes, I think either way could work.
Does anybody else have questions for Tim?
Oh, well, just one more thing. Is this widely available now, or is it still prototype, or is it something that people can access now?
These documents are ready to be shared, and you know, potentially Rachel's going to share them afterwards, but certainly we can disseminate them as well. They exist kind of as a generic version that could be turned around and used tomorrow, if you will. But if there's a particular organization that needs something a little more customized, then we can dive in behind the scenes and try to create the content that's specific to that community that they're serving and the local geography that their clients come from.
That's great. And I really think too, like just in reviewing these documents, that sometimes when you're in like the healthy food space, like it seems like, oh, like obviously we would go to WIC, or we would like refer someone to EBT or SNAP, but in spaces like universities, they might not know off the top of their head, like what are the, like I come from Head Start, so like we knew like the federal poverty guidelines like almost by heart, but if you're not in that space and you don't understand like, oh, SNAP and WIC are different and there's different guidelines and you can qualify for one and not the other. So I think this is a really helpful tool, again, for folks who might be working with people who would benefit from this, but not in that direct space. So thank you so much, Tim, for sharing. And I'm gonna share along with the meeting minutes and the PowerPoint in the recording and the whole package. So folks can use as they see fit. So thank you, Tim. And then last but not least, we have Martha from Feeding America.
Good afternoon, everyone. I'm Martha Collins with Feeding America Eastern Wisconsin. I am the new Director of Advocacy and Outreach over at Feeding America. I've only been there for a couple months, but I did want to share a really cool initiative or project we did within my first month or so of being there, and its success. So it was a partnership with the Milwaukee Health Department as well as the Medical College of Wisconsin for the COVID-19 vaccination clinics. So there were two clinics, one on the south side on 23rd and Mitchell, and the second one on the northwest side, right by the Northwest Health Center, but this station was located right in the old, what's that, Mill Road Library. And the partnership was between the three entities, which obviously was for folks to get their vaccinations. But at our role at Feeding America, we were able to provide what we called goodie bags, which had some non-perishable items, as well as hand sanitizer and some other PPE type of materials in the bag, in the goodie bag, and was offered to the first 100 individuals that were vaccinated. Also, within our goodie bags, we provided a lot of the information around the different federal nutrition program changes. So there's been a number of changes to the SNAP program from the emergency allotment benefits to the pandemic EBT. Things with WIC now has just been announced as far as an additional $35 for fresh fruits and vegetables over the summer months. Summer pandemic EBT, I mean, it's so much at one time. And it was great to meet people where they're at within their communities, and they couldn't run from you because they had to wait 15 minutes after receiving that shot. So we were able to do the outreach again at those clinics, providing that those changes information help people apply for benefits if they weren't receiving them, and just kind of provide them with information. A lot of misinformation is out there as well, and so it was great. It was a huge success. Over 5,000 people were vaccinated between April 19th and April 30th at those two sites, and yeah, it's just hearing, I'm like, I'm in the right space, in the right room, just hearing the previous speakers talk. There's changes to SNAP with eligibility for college students. And so we had a handout and flyer at the sites letting folks know that college students temporarily are eligible for SNAP benefits. And again, not a population that would typically know or understand the federal nutrition program. And so we've been in contact with the different colleges now. They got wind that we were passing this information out, and federal, the FAFSA or the Bursar offices at the colleges and universities are now using our materials. But again, a great partnership with the health department as well as the Medical College of Wisconsin, and 5,000 plus people now have received access to some food, but also information about how to apply or additional food benefits for their household so that they can go purchase the food that they need and they want with dignity. So thanks again for folks that's on the call that was in partnership with me on that project, and look forward to working with Meg, and I've jotted down so many names on moving forward and getting more information out to the community. Thanks.
Thank you so much, Martha. Does anybody have questions for Martha? All right. Well, I want to say thank you so much to the four of you for just sharing some success that you've had around economic security within the pandemic that directly relates to the work that we are all trying to do around economic security within MKE Elevate. And I hope that as you were listening, I know as I was listening, specifically these four are around food security and healthy food access particularly, but there are other ways that these projects have kind of had offshoots, I don't know how to say the plural of that, but into other spaces. And I think these are all models too, that it doesn't even necessarily have to be food access, but Martha touched on food access and how that intersects with vaccination, or Tim was talking about just as students come back to campus, maybe this process that they've already been doing, we can just implement a food security or food insecurity questionnaire into that. So I hope that you kind of saw that these aren't just about food security or economic security, but that these models can really be replicated into other ways to address public health issues. So thank you guys so much. And I'll be sure to, when I send out the minutes, I can just put their emails if anybody wants to follow up or collaborate on any of the projects that they've been working on. So it is 12:24. I apologize. I was a little bit of a chatterbox. I'm very excited to get back into this work. I have been working on vaccine communications since pretty much December. And then I was able to pivot in February and then went right back to vaccine. So just being able to collaborate on some of this community work is really where my heart is. And so I talked just a little bit too much, but I'm going to go ahead and put the questions that I had outlined in the agenda. I'm going to put those into the chat, and I'm also going to put those in the questions into, they got a little jumbled in the chat, so I apologize. But I'm going to put those questions, if they're not already represented, in the check-in document as well, because really I hope that after hearing about some of the work that's being done with other organizations and hearing about our vision for Elevate from now until the end of the year, and even just into the next cycle, that we're really just trying to get across, like, we want to hear from you. What are your successes? What is your organization working on? How can we help? How can we facilitate partnerships? How can we connect you to work that's being done? Maybe you're an organization that works around fresh food access, and now you're learning that there's a fresh food access fund. And so maybe there is some grant funding out there with other organizations that you're able to work with. So really that's what we see our role at the health department as. And so even if you don't fill it out today, I'm going to send the link again to that check-in document. You can send me a direct email as well if there's something where you have ideas about evaluation, if you have questions, you're still confused about something, you want to connect with maybe one of the speakers, I can help facilitate that connection as well. And so just for next steps, so myself and Amanda will be coordinating so that each person on the action team will reach out to you within the next couple of weeks, because we want to start to plan out those one-on-one meetings. Just to kind of hear like what is everyone working on? How can we help? What are some ideas on maybe some support that you would need? Is there any way we can connect you to some of the work being done in this space? What can we do better? How can we help maybe with your organization's strategic plan or any of your projects around economic security? And Yvonne is asking what the check-in document is to update. So I just created a Google document and I'll put that in the chat again. I'm just asking like some check-in questions. So like if you have questions about what we've been talking about or ideas, it's just a Google document, so you can just fill it in, and you can see your name while you're typing it, but otherwise it's anonymous. So if you have questions that you want to ask, you can go ahead and do that. So we will end 2 minutes early. Thank you guys so much for your time. I'm going to go ahead and make sure everybody gets the recording, the PowerPoint, the agenda with any of the minutes, which there won't be a lot of minutes because I did most of the talking, so I apologize for that. But we will be reaching out to everybody who has been participating, because we really want to hear from you and see how things are going. So thank you guys so much. If you have questions, you have my email, and we look forward to connecting really soon.